Hi everybody, my name is Catherine. I've been a labor and delivery nurse here at EIRMC for the last 11 years. Today I've got Jaron here with me. He's one of our anesthesia providers. He is going to walk us through an epidural placement.
Okay, perfect. As an anesthesia provider, we get a lot of questions about positioning during an epidural. So, biggest thing is we'll have you sit up nice and tall at first. When you're sitting like this, I always like to show your back is kind of like this. Your vertebrae are really close together. The positioning is we want you to drop your shoulders down, relax, stick that back out kind of like an angry cat. What that does is it lets those vertebrae separate. That's right where we need to go with the needle. So once you're in this position, I'm going to be just touching your back a little bit, feeling for my spaces. We go below the spinal cord at about the level of your hip bones. Once we're there, I'm going to kind of press my finger against you. I'm going to grab a tiny needle. All that is to localize that area. I'll tell you everything I'm doing. You may feel a pinch and a burn. We put in that local anesthetic. After that, I get the bigger needle. Once that bigger needle's in place, and it only takes about maybe 30 seconds, maybe to a minute with that bigger needle in place. Once the bigger needle is in place, we thread this catheter, this thin tube. You can see it's flexible. We thread that into the epidural space. Once that's in place, we pull out the bigger needle. We use some tape. We tape up the catheter nice and tight. That way it's not going to fall out. And then we start to give you medicine back there. That way you're nice and comfortable.
What if I'm not completely comfortable? I'm still hurting a little bit.
If you have pain, let us know. Sometimes it's down one leg. Sometimes it's up here, over here, down here. We can always give you more medicine. We can also kind of maneuver this catheter if we need to. Sometimes all we need to do is pull it back a little bit. Worst case scenario is we redo it, but that's very rare. All of our anesthesia providers are great, and we all work to try to make it so you have the best experience here. We'll give you as much medicine until you're as comfortable as you need to be.